Coarctation of aorta is the narrowing of aorta at aortic isthmus, which is the distal part of the aortic arch, close to ductus arteriosus and left subclavian artery. Etiology of coarctation of aorta include congenital and acquired causes. In congenital, we can see hemodynamic, which is caused by underdevelopment of aorta due to abnormally decreased integrate intrauterine blood flow, and ductal is caused by closure of ductus arteriosus, tissue that extends into the thoracic aorta. Coarctation is also associated with Turner syndrome, that is, in 5 to 15% of female patients with coarctation of aorta have Turner syndrome. Coarctation is also accompanied by bicuspid aortic valve or VSD or ASD. Acquired causes include Takayasu arteritis, which is as well as severe atherosclerosis is also a cause of coarctation of aorta. Clinical features of coarctation of aorta include differential cyanosis, which is seen in the figure, that is pink upper extremities and cyanotic lower extremities. Brachiohumeral delay, that is high blood pressure in upper extremities and low blood pressure in lower extremities, that is pathognomic sign for coarctation of aorta. Cold feet, lower extremity claudication on physical exertion, systolic ejection, murmur, headache, epistaxis and tinnitus are also described as clinical features of coarctation of aorta. On diagnosis, BP measurements show us brachiohumeral delay, that is best initial test to be done for coarctation of aorta. We can also do pulse oximetry, which shows us low SpO2. Doppler echocardiography, that is confirmatory test for coarctation of aorta, shows us location and extent of the stenosis. X-ray shown here shows us figure of 3, that is due to hourglass narrowing of aorta, and also rib notching, that is between 3rd to 8th rib, is also seen in the figure here. We can also do MRI and CT, but it is only done in the complicated cases that determines the length of coarctation, and genetic testing is done for Turner syndrome. Treatment of coarctation of aorta include initially prostaglandin is given to the patient, but balloon angioplasty is done for most patients that are less than 5 years of age, and for older patients transcatheter intervention is usually recommended.